premiers will accept the federal government's health care funding deal. The Prime Minister tabled that offer less than a week ago. Here's a quick reminder of what is being offered. More than $46 billion in new spending over a decade. A 5% increase to the Canada Health Transfer for the next 5 years. That's included in that $46 billion and would amount to $17 billion, which is, of course, below the extra $28 billion a year the premiers collectively were calling for. There will also be an immediate and unconditional $2 billion top-up to the health transfer. Joining us to talk about this deal and the decision to accept it is Manitoba's Premier Heather Stefanson. Premier Stefanson also heads up the Council of the Federation, which collectively represents all the premiers. Hi, Premier. Good to see you again. Thank you for making the time.
Great to be here, Vassy.
Was there any other option but to say yes to this deal?
Well, I think Canadians want to see us working together, and I think after 2.5 years of trying to get to a table to have these discussions, I think this is a positive step in the right direction. We had a good meeting with all of the premiers across the country today. We've agreed to accept the federal funding from healthcare, but we also recognize that there's much more work still to be done, particularly for the long-term sustainability of the Canada Health Transfer. And so we will be writing to the federal government and to the Prime Minister to address some of those issues as well.
Can you tell me what the content of that letter will be? Are you looking for a bigger increase than the 5% escalator, for example?
I think what we want to do is address some issues that came up at the meeting. Issues around making sure there's fiscal sustainability with respect to the funding for the territories. Also addressing issues around a potential fiscal cliff as well. So what happens at the end of these bilateral agreements? We have existing bilateral agreements. What happens at the end of the expiry of those agreements? Some of those are coming up within the next 4 and 5 years. We need to address those. We also need to address the 10-year agreement and make sure there is no fiscal cliff as a result of those, but also addressing the Canada Health Transfer, making sure that there's long-term sustainable funding for Canadians when it comes to their healthcare system.
So let me just try and understand this, I guess, in layman's terms. When you're talking about a fiscal cliff, are you saying the premiers are trying to stave off the possibility that if, for example, revenues really deplete because of a massive recession into federal coffers, that doesn't limit or impact transfers from the federal government to provinces?
No, what happens at the end of, say, a 10-year bilateral agreement is that funding ends. And so if it's not put into the baseline funding moving forward, then some of those programs that those monies have been invested in will be in jeopardy. So we want to ensure that at the end of the agreement time, that there is still a continuation of the funding moving forward to ensure that Canadians get access to those healthcare services that they will have had access for the last 10 years.
What's the point, though, of having an agreement if the money just keeps going after it?
Well, this is often what happens, and in the past, some of the monies have gone for bilateral agreements have gone into the baseline funding, so into the Canada Health Transfer in this case, at the end of that, to ensure there's continuity when it comes to making sure those healthcare services will continue to be delivered. What we don't want to do, and that's why we were asking for long-term growth in the Canada Health Transfer itself, because again, that's more money to the baseline funding, so you don't have that fiscal cliff at the end. What we want to ensure is that does not take place. For example, the bilateral agreement that was signed back in 2017, it comes up in 4 to 5 years from now. So what happens to those programs after that? That will be part of these discussions in our bilateral agreements. We just want to make sure that it has a longer-term sustainable funding for the future of Canadians.
I want to ask you a question, and I ask this with respect, and hopefully it doesn't sound crass, but I think the way it appears to Canadians is that the federal government said, here, take it or leave it. It wasn't really a negotiation. They just presented you, and this is even the way you described it on our program Wednesday night following the meeting with the Prime Minister. He just sort of said, here's the deal. Do you want it or not? If you're trying to now negotiate all this other stuff, are you kind of concerned that the negotiating power of the provinces collectively has been diminished given the way this all unfolded?
Not at all. I think, let's look back. The last 2.5 years, Vassy has taken to get to a table and even see a proposal from the federal government. So we're there now. That's a positive thing. But I think it's prudent moving forward that we address some of these issues in the way of a letter to make sure, the Prime Minister is aware of some of the concerns that we have after these bilateral agreements end. So we'll be addressing some of those issues with the Prime Minister, and we'll take it from there.
And I'm not trying to take away from the presence of those issues, but for so long you had been calling for this meeting, you presented a unified front, and it got you, 1/6 of what you were asking for.
So there's $46 billion on the table right now, and more, $46 billion more than the federal government had on the table before. So that's a step in the right direction. We recognize that. We know that this does not go towards the long-term sustainability when it comes to long-term, sustainable funding for our healthcare systems. That's why we want to continue to have that discussion. For right now, we recognize this is a step in the right direction, and so we will accept this.
Was your ask out of line? And I ask that just because of the situation that occurred during the pandemic, where there were really large transfers from the federal government to provinces around healthcare that contributed to a very large deficit situation for the feds. Should the premiers have recalibrated their ask to better reflect the fiscal reality?
No, I think we put, again, 2.5 years ago or 3 years ago, we put an offer on the table for the federal government, and it took them 2.5 years to come back to us with this. We recognize, again, that this is a step in the right direction. We'll take that for now, but we want to continue those discussions about a long-term funding model for the sustainable funding model for Canadians with respect to our healthcare systems.
Okay, Premier Stefanson, I'll leave it there. Thanks very much for your time this evening.
Thanks, Vassy.